So this is Candida, which is yeast inside the nose. And this is after we treated the air, got the air count down to close to zero fungus. And then the drugs work because you're not continuing breathing it. So this is putting antifungals in the nose, getting rid of the Candida in the nose here. So one on the right is after killing it with antifungals, amphotericin, citradioxin, GSE. And
So
then
go for a moment though on how's the relationship of Candida and mold?
so mold is a fungus. So under the fungi, you have mold and yeast, right? So yeast is a fungus. So they're all in the same family. They all have the same
Mhm.
cell wall structure. So they all do the same thing inside the sinus. So if you are sensitive to one of them, you'll react to the other ones eventually. So you have to get rid of all of them. And so this is normal tissue here, and this is all Candida inside the nose. So you got two things you got to do. You got to get your air clean and your diet clean. Both of those are producing fungus in the air. So the air is the most important because there's more volume. And then secondly, if you're eating all your carbs, your bread, rice, potatoes, and sweets and sugar, you overgrow yeast in your gut, and the yeast produces gliotoxin. And so you've got to eat a Candida diet, which is like all your meats and seafood, all your veggies and your fruits or berries. And what you're eliminating is all the white stuff,
Mhm.
all the sugars, bread, rice, potatoes, sweets, and alcohol. You're eliminating those things. And then you can kill the yeast. But if you don't stop eating sugar, meaning the carbohydrates that are refined, you cannot get rid of yeast because you make them resistant to the antifungals because you change their physical shape. They change into an invasive hyphoform. Hyphae are like roots that go down in your tissue, and they're 3 feet long, and they make you resistant to all the antifungals. So it's
Wow.
not that you're resistant to the drug; it's that you're eating sugar, and you can't kill fungus if you're eating sugar. I don't care what you take. You know.
Yeah. So going back to you said we get yeast overgrowth in the gut, and then how does that Candida overgrowth, yeast overgrowth get into the nasal passages?
Well, they also have it in their air, because they're breathing it through the air. So
Okay.
a lot of patients, if they do mold plate testing, they'll have telomeres to count yeast in their bed, which is coming off their skin, and then they're breathing it.